Um, so what is Youth in Pre-Med? We are a program that teaches about science and medicine, and we help youth build connections in the community through STEM programs. And so we want to immerse youth in medicine at a younger age to better prepare them for a career in medicine. So what we're offering this semester is for you to learn about fascinating science topics and medical breakthroughs, discover the importance of science in pandemic during this difficult time, and receive references for highly selective youth programs when they open. And you'll learn to apply to and interview for these programs. And you'll also, for middle school students, they'll be able to connect with high school students who can provide advice on how to succeed in high school. And so we'll also be hosting a lot of speakers who work in various medical specialties. So in the past, we've hosted students from Stanford University and also doctors from Kaiser Permanente. And this semester, we'll be hosting surgeons, psychiatrists, travel doctors, and more. And many of those will be working on the front line, so you'll be able to ask them a lot of questions and also hear about their experiences. So does anyone have any questions about that? You can feel free to type them in the chat or email us if you do have any questions, or if you're wondering about like the speakers or our schedule and stuff like that. So for now, for like the exciting part, I'm going to pass it off to the volunteers to talk about medical.
Okay, so what are medical specialties? Medical specialties are branches of medical practices where individuals may choose to specialize in. So some factors that may affect which specialty you choose include specific groups of patients, diseases, skills, or philosophy. So a few examples of these are pediatrics, family medicine, or laboratory medicine. And just an FYI, there is no rush in choosing your specialty now. You may select one when you're applying for a residency, which would be after med school.
Let's begin by talking about neurology. A neurologist is a medical doctor that specializes in diagnosing, treating, and managing disorders that affect the brain and the nervous system. You might be wondering, how do neurologists diagnose and treat disorders? Well, they start off by diagnosing disorders in patients by performing tests and procedures. Next, they give their patients and their family a prognosis and treatment options, as well as side effects. Lastly, neurologists help manage the patient's disorders through their treatment by performing new tests, making changes to treatment if necessary, and noting down the patient's progress and symptoms or side effects. Now, here's some more information on neurology. You might be surprised to hear this, but there are actually different subspecialties within the field of neurology. Let me tell you a bit about them. They include child neurology, which includes diagnosis and management of neurological disorders in children, memory disorders, which affects one's ability to remember and make decisions, movement disorders, which affect movement, neuro-oncology, which treats sleep, neurocritical care, which takes care of life-threatening neurological disorders, neuromuscular disease, which affects muscles and nervous system, neuropsychiatry, which causes behavioral and psychological issues, neurorehabilitation, which helps recovery from a nervous system injury, and neurovascular, which involves nerves and blood vessels. Each subspecialty focuses on different disorders and different aspects of neurology. Although there are many disorders that neurologists are trained to treat and diagnose, the most common ones are epilepsy, amyotrophic lateral sclerosis, Alzheimer's disease, brain tumors, cerebellar disorders, multiple sclerosis, Parkinson's disease, and stroke. Lastly, you might be questioning, what's the average residency length and salary for a typical neurologist? Well, on average, neurologists have to complete 3 years of residency in which they have to care for patients, do research, and go through clinical rotations. The average salary for a neurologist is $260,000. However, if you do choose to pursue neurology someday, make sure you do so because you're interested in the field, not only because of the money. Well, that was it for neurology.
Hi everyone. So we're now going to talk about ophthalmology. Ophthalmologists help diagnose and treat eye disorders. To make these diagnoses, ophthalmologists first run tests to check whether a person's eyes are healthy using visual acuity chart tests, slit lamp examinations, and more. You've probably seen these tests when you've gotten your eyes checked by an eye doctor. Then, based on these tests, they either find that the person's eyes are healthy or provide the person a diagnosis. If the person has an eye condition, then the ophthalmologist decides the treatment for that condition. Some of the treatments include eye drops, laser treatment, surgery. Some of the conditions that ophthalmologists diagnose and treat include cornea diseases, dry eyes, and macular degeneration. However, the most common conditions that they treat are cataracts, which is shown in the bottom picture, which is a clouding of the the lens of your eye, and glaucoma, which damages the nerve connecting your eye with your brain. Ophthalmologists can even specialize in a specific field of ophthalmology. Some subspecialties include pediatric ophthalmology, which is treating the eyes of children, glaucoma, neuro-ophthalmology, and oculoplastics, which is the treatment of your eyelid and your tear duct. Being an ophthalmologist is a very meticulous job since the eye is a small, delicate organ. Also, you'll need to be a resident for 4 to 5 years to become an ophthalmologist, in addition to undergraduate and medical school. That means you may need to be in school for about 12 or 13 years to become an ophthalmologist. However, ophthalmologists are actually considered to be one of the happiest medical professionals, and you get to give better eyesight to patients, which can definitely be a self-fulfilling job. Lastly, I'll talk about the salary of an ophthalmologist. Out of all the specialties we'll present today, the salary of an ophthalmologist is somewhere in the middle, with an average salary of $298,977. That's definitely a lot of cash. So yeah, thanks for listening. I'm going to pass it on to Katie, who will talk about endocrinology.
Hello everyone. You might be wondering, what is endocrinology and what do endocrinologists do? Endocrinology is the branch of physiology and medicine concerned with endocrine glands and hormones. Endocrinologists diagnose and treat hormone imbalances and other problems with your body's endocrine glands. You might be wondering, what exactly are endocrine glands? Endocrine glands include the hypothalamus, pituitary gland, and pineal gland in your brain, the thyroid and parathyroid glands in your neck, the thymus in between your lungs, the adrenals on top of your kidneys, and the pancreas behind your stomach. Some subspecialties of endocrinology include pediatric endocrinology, reproductive endocrinology, diabetes, and metabolism. However, all of these subspecialties do the same thing, which is treating hormone-related issues. Some common conditions that would cause you to visit the endocrinologist would be diabetes, thyroid disorders, polycystic ovary syndrome, and low testosterone, which are all related to your hormones. If you're interested in this profession and would like to become an endocrinologist, you should expect to complete 3 years of residency. The yearly salary earned working as an endocrinologist is around $246,000. However, that amount can vary due to various situations and conditions. Now, let's talk about another medical specialty that might interest you.
So now we'll talk about pediatrics, and I'm sure most of us are familiar with this field as we have a pediatrician, but let's go in depth. Pediatrics specifically overlook children's health by treating, diagnosing, or preventing illnesses. And to be specific about children, they're usually 0 to 18 years old, sometimes 21 years old. And since they're overlooking children, they'll also have to monitor their development physically, emotionally, and mentally, because children grow at an exponential rate compared to adults. In addition to their medical contributions, they will also give advice to parents to monitor or prevent illnesses for health reasons. For example, they may suggest when it's time to stop using breast milk and switch to solid foods. But in order to pursue that field, you'll need to go through 3 years of residency. During residency, you'll do rotations that are necessary to treat your patients. For example, urgent care, newborns, inpatients, and development. If you want more specialty, you'll need to do a fellowship. And on the topic of a specialty, there are pediatric subspecialties. There are pediatric cardiology, adolescent medicine, pediatric emergency medicine, and much more. They simply cater to child patients in their specialty. And you might be wondering by now, what are some common conditions that the pediatric field treat? Obviously, this differs by your specialty and the age of your patient. But I don't think most pediatricians will be doing your life-threatening heart surgery, so they'll refer you to a specialist. But children will usually have a common cold, flu, stomach flu, hand, foot, mouth disease, strep throat, or head lice to treat. And lastly, it's probably something you've been waiting for, which is the salary. Although you shouldn't do medicine for the money, it's something we all think about. The national average salary is around 222,000. But you should take into consideration of experience, position, state, and other external factors. Now, let's move on to the next specialty.
Hi everyone, I'll be introducing you guys to dermatology. So you may be wondering what dermatologists do, right? Well, they are physicians, otherwise known as doctors, who treat adults and kids with disorders in the skin, hair, and nail. In addition, they do diagnose patients such as skin cancer, tumors, or infectious diseases. Lastly, they also perform dermatological surgical procedures. An example would be performing surgery on your skin to treat whatever disorder it may be coping with. Now, you may be wondering, what are some common health conditions that are treated within dermatology? Well, they include treating acne, skin rashes, skin cancer, infections on your skin, hair loss, and nail problems. All right, let's dive into subspecialties within dermatology. Some subspecialties within dermatology includes dermatopathology, which helps treat diseases within the skin, hair, or nail in the microscopic and molecular level. Next subspecialty is pediatric dermatology, which specializes mainly with treating kids like infants, children, and teens. Lastly, there is procedural dermatology, which specializes in more of the study, diagnosis, and surgical performances. All right, moving on, we'll be diving into the residency length. So the average length of residency is about 3 years plus one postgraduate transitional year, which means an additional year to check on of how you're doing. It is also said that dermatology is one of the most competitive competitive specialties within the medical field. But if you're able to persevere through the hardships, the rewards are very rewarding, such as their lifestyle. It is also known that being and working as a dermatologist is one of the least stressful medical specialties. Lastly, let's get into how much dermatologists earn. It is said that they earn an average salary of $455,000, which is definitely on the higher end of the various medical specialties. And that basically sums up dermatology for us. I hope you guys learned something interesting from this presentation. Now we'll be moving on to the next medical specialty.
So another medical specialty is cardiology. To break it down, cardio is the Greek prefix for heart, meaning that a cardiologist is a doctor who specializes in the heart and blood vessels. A cardiologist treats, diagnoses, and prevents conditions or diseases in the cardiovascular system, which is mainly the heart and blood vessels. Some things a cardiologist might spend their time doing in a day consists of performing an examination, ordering tests, interpreting those tests, prescribing treatment, advising lifestyle changes to keep the heart healthy, providing counseling, and performing a few procedures. Introducing the subspecialties within cardiology, a cardiothoracic surgeon is the one performing more complicated surgical procedures on the heart and blood vessels. The subspecialties of cardiology consist of a general clinical cardiologist, which is what we're talking about, a cardiothoracic surgeon, an echocardiologist, a nuclear cardiologist, a heart and failure and transplant cardiologist, and a preventive cardiologist. All of those in these subspecialties have learned a deeper meaning of their specialty rather than focusing on everything like a general clinical cardiologist. One question you may have are, what conditions does a cardiologist treat? Well, some common health conditions that a cardiologist might diagnose or treat are heart attack, heart failure, high blood pressure, infections of the heart, heart valve problems, heart and vascular disease, and heart defects. Now for some information on becoming a cardiologist. The length of residency in internal medicine is 3 years, which follows with a 3 to 4 year fellowship in cardiology. although other subspecialties have different lengths and requirements depending on how in-depth you want to learn on a certain part of cardiology. Lastly, the average salary of a cardiologist is around $454,000, depending on the state, experience, position, hours, and more. But don't let salary length determine your path. You should also take into account the residency length, what someone does in a specialty, and other personal values. And that's cardiology, so now we'll move on to the next specialty.
Hello everyone. Another medical specialty that might interest you is oncology. So what is oncology? In general, oncology is the branch of medicine that focuses on cancer, a disease where cells divide uncontrollably, damaging or destroying body tissue. Moving on, the medical professional that practices oncology is called an oncologist. What does an oncologist do? An oncologist treats, diagnoses, and tries to prevent cancer. An oncologist might do a physical examination to find tumors, and they also might do blood tests, ultrasounds, CT scans, and MRIs to test for cancer. There's actually a few different subspecialties for oncologists. One is a radiation oncologist, which focuses on treating cancer with radiation. Next is a medical oncologist who specializes in treating cancer using chemotherapy or other medications. Another is a pediatric oncologist who specializes in cancer in children. And then other subspecialties include a hematologist, oncologist, which specializes in blood cancers, and a gynecologic oncologist. Some common conditions that an oncologist might treat include types of blood cancer, breast cancer, brain cancer, lung cancer, skin cancer, and pretty much just any type of cancer. Now, here's some information on how to become an oncologist. There is a 3-year internal medicine or pediatrics residency, and then a 3 to 5 year fellowship. Lastly, the average salary for an oncologist is $383,000 a year, but that varies depending on things like subspecialty and experience. That's all for oncology.
Many of you have heard of an anesthesiologist, but what do they do exactly? An anesthesiologist is a doctor who monitors the patient during surgery, administers anesthesia and sedatives, and can administer pain medication out of the OR. In a nutshell, they oversee the patient's safety and can keep them pain-free. Before the surgery starts, the anesthesiologist preps you for the surgery. They take your metrics, weight, height, BMI, etc., and ask for any diseases or allergies that you might have. They use these measurements to determine a safe amount of anesthesia. The anesthesiologist oversees your safety during the surgery and monitors vitals and identifies and manages problems that you might have. After the surgery, the anesthesiologist monitors your recovery and decides if you have completely recovered from anesthesia. They create a plan for your recovery and can send you pain medication home. It may seem surprising, but anesthesiologists have many subspecialties, much like a surgeon. Because of how anesthesia affects your heart and brain, there are subspecialties for procedures involving those organs. These are called neuroanesthesiologist and cardiac anesthesiologist. High-level pain medication might be needed for hospice care, thus a subspecialty for hospice and palliative medicine. Have you ever heard of an epidural? Anesthesiologists who specialize in pain relief when giving birth, obstetric anesthesiologists give these shots. An anesthesiologist needs a residency like any doctor. They need 1 year transitional, some may call this an internship, 3 years residency, and if they want to go further, they have to have another year of fellowship. Last is the big question. How much do they get paid? The average salary is $405,000, but can vary to a variety of factors. Although their salary is very high, the risk to be an anesthesiologist is quite high, and if you're not focused, it could prove fatal to the patient. Anesthesiologists are in their position because they're passionate about their job, not for the money. That concludes anesthesiology. Now on to the next specialty.
Another medical specialty you might be thinking of pursuing a career in is psychiatry. So starting off, you may be wondering, what is psychiatry? Psychiatry is a field of medicine focused on understanding and treating mental health disorders and psychological distress. Currently, psychiatrists use the Diagnostics and Statistics Manual, DSM-5, to help them assess these psychological disorders, such as schizophrenia, depression, bipolar disorder, eating disorders, and drug and alcohol misuse. But they also help with psychological distress, such as pain, trauma, and difficult relationships. There are numerous psychiatric subspecialties, including child and adolescent, forensic, and addiction psychiatry. Have you ever confused a psychologist with a psychiatrist? Well, you're not alone. Both are experts in mental health, but psychiatrists are medical professionals who have a basic degree in medicine, followed by a specialized 4-year residency in psychiatry. Psychiatrists, on the other hand, mainly identify a particular disorder and prescribe medicine,
This
but
is
they also
that doctors come. You want to see psychiatry?
but they sometimes provide psychotherapy. On the other hand, psychologists have a bachelor degree followed by extensive psychology training and a PhD doctoral degree. Psychologists mainly support people by providing psychotherapy, but they're unable to prescribe medicine. An important part of being a psychiatrist is being adept at relating to a wide range of individuals and having interpersonal skills. The DSM, as I mentioned earlier, helps guide these psychiatrists, but it's also important to take a holistic approach looking at all aspects, the psychological, socioeconomic, and physiologic causes of one's symptoms. Lastly, the average salary of a psychiatrist is $344,000 per year. But while considering which specialty is right for you, choose a field that you're passionate about and take into account all factors which makes up a certain field. And that's psychiatry for you.
Next up is radiology. Radiologists are doctors who use medical imaging, such as X-rays, ultrasounds, MRIs, to treat and diagnose illnesses. Radiology is a very important medical field as it allows physicians to peer into the interior of the living human body without actually cutting it open. Some specialties of radiology are breast imaging, cardiovascular radiology, chest radiology, emergency radiology, and pediatric radiology. Some common conditions that are associated with radiologists are cancer, Alzheimer's disease, brain tumors, and more. The average length of residency is around 4 years, and it includes a 1 to 2 year fellowship. The average salary for a radiologist is around $429,000. However, if you choose to do radiology, make sure you pursue it because you're passionate about the career and not just because of the salary.
Nearing towards the end, I'm going to give a brief summary of what we covered today, as well as what we're going to be covering in our next presentation. So the medical specialties that we covered today were Neurology, Ophthalmology, Endocrinology, Pediatrics, Dermatology, Cardiology, Oncology, Anesthesiology, Psychiatry, and Radiology. Although these were the specialties that we covered today, please keep in mind that these aren't the only specialties that you can choose from. There are still so many other fields that there are. And for our next session, we will be having a guest speaker. Our guest speaker will be Dr. Anne Chuang, and she is a board certified breast surgeon based in New Jersey and Montclair. She'll come and share about her work. And when she's here, you guys are free to ask any questions. You can learn more about her at her Instagram, which is at Dr. Chuang, or you can also visit her website, which is www.drannchuang.com.
Okay, so now we'd like to open this up to questions that anyone may have. But before you guys unmute, I had some questions in the chat that people chatted privately. One question is, what is a residency? So a residency is something that you apply for after medical school, and it basically gives you experience in the field that you want to specialize in. And another question was, do you get paid during a residency? And yes, you do get paid, but it's not as much as the salary of a licensed doctor. There was also a question about endocrinology, about the residency and the salary. So we can go back to that. So the residency length is 3 years and the salary is $246,000. And so this is like the average salary. And like our volunteers previously mentioned, it can vary based on the state or your experience within that field, or like how long you've been doing it, and also a variety of other factors. Yeah, thank you, Kathleen, for dropping the information in the chat. So does anybody have any questions? You can feel free to type them publicly or privately, and also unmute yourself. Yeah, okay, so fellowship is, it's like a residency, but it's like, it gives you extra experience. So it's something that you do on top of a residency, and I believe you do get paid for that as well. But it's just something to help you become more specialized in a specific field. Which one takes the least work and makes the most money? Obviously, it's not like it's not something that you should consider like the most. I feel like your interests and your desire to help people or the community is something that you should definitely take into account more. But from some of the sources, optometry and dermatology are usually the ones that require the least amount of residency length, and also they also make a fair amount of money. Yeah, it definitely depends on your interests, and if you're passionate about something, you'll definitely find it easier. Yeah, we can go back to the radiology slide. So the average length of the residency is 4 years, and then you also have an additional 1 to 2 years of fellowship, and your average salary would be $429,000. Okay. So a lot of people are asking for the Discord link. Oh,
I have it.
I have it as well.
Wait, sorry. We had a question about optometry, I think. Okay, here's the slide. They basically treat diseases in the eye. I think this is very similar to optometry. Bryce, do you want to explain this one? People are asking what ophthalmology does.
Oh, they're asking like what it does specifically?
Yeah, like what it does. Mm-hmm.
Yeah, pretty much ophthalmologists pretty much just treat like diagnose and treat eye disorders. So, like they run tests based on like, like the eye chart test, like where you have to read the letters and it gets smaller. And then, like different other tests like retinal tests. And then based on that, they kind of like diagnose they see whether the eyes are healthy or not. And I think there's like a difference between optometry and ophthalmology. I think ophthalmologists have a little bit more, they're a little bit more experienced, or like they're able to diagnose more eye disorders, whereas ophthalmologists, I think they're more about like just like the more common like myopia or like the regular like with the glasses. So ophthalmologists, they kind of have more they're more for more like the other conditions, like the more like conditions like such as cataracts and glaucoma.
Yeah, definitely. We also had a question, is medical the same as residency? No, they are not. So the basic pathway would be graduating high school, and then graduating college, and then after that going to medical school, and then after medical school you would apply for a residency. How much do optometrists make? We don't have that in the slide, but as we move on to the resources, we do have that on our website, and our volunteers have written articles on the website about various specialties that were not covered in this session. And so we'll be sending that out to the in the recap email. So make sure that you've signed up for the program and you're on our email list if you're interested in getting that. So some resources we have is that the spring semester scheduling outline. You can find that right here. So we made a bit.ly for it, and it's just bit.ly.yipm spring schedule. And this is the link to our Discord server. If a volunteer could drop that in the chat, that would be great. And then this is our Instagram. You can also find the link to our Discord server there. And so this is our email. You can email us with any questions. And then we also post the recordings on our YouTube channel after every session. So you can access that through a bit.ly link. It's just YIPM YouTube at the end. And so for easier access to the Zoom link, we just made one. It's http bit.ly/YIPM Zoom link, and that's also on our Instagram. And as mentioned, we have articles and more resources on our website, and we'll send that out in our recap email.